So we've talked about some of the ways, major ways,
Yes.
that patients are disheartened and probably go elsewhere. What are the ways that keep patients happy and wanting to be there with you?
Okay, 2 words. Concierge service.
Good, go.
Concierge service. I truly believe that we need to make sure that every aspect of our patients' needs are addressed from the moment they call on the phone to the moment we dismiss them at the end of an appointment. And we need to delight them, and we need to surprise them, and we need to far exceed any expectations
And if it
they
could
may
be
have
seamless, so much better.
And it will be seamless.
Yes.
It will be seamless. You know, one of the first things we have to do is, and you hear this talked about in business all the time, is figure out not only your why, but your USP. You know, who are you uniquely? And that comes about very much so by defining the practice owner, who the practice owner is as a person, who they are as a professional, what their values and ethics are, you know, what kind of practice they want to be. And that can be anything. There are no right and wrong answers. It's just about defining and identifying and defining them. Yeah. So those are the first things we have to do. We have to identify and define who that practice owner is in all these different ways. And in a very, very honest way. And from there, let's take a look then at who our staff is. You know, do we have the right staff members in place? Or do we have the right staff members in place, yet they're in the wrong place in the practice? So I'm a firm believer in repurposing those people. And so to that end, we've figured out who he is, or she, and now we've figured out who these staff members are. And now how do we bring everybody together and put them all on the same message? Well, they have to drink the Kool-Aid. You know what I mean?
They need to know the vision and where it's going.
They have to buy into who you are as a practice owner.
And why you're going to do it the way you do it.
And why you are doing it the way you're going to do it. And that can literally be them all sitting down with you and having a huge powwow session. You know, go into a closed room, you know, at a conference center somewhere away from the office, and everybody bring their ideas to the table. Everybody sit down and have an important conversation about what we think this looks like.
This is so important because when I speak with dentists and I work with teens, one of the things I like to bring up is I have been observing you. I noticed this is your stated mission that you want patients to see. But these are the underlying things I observe are the things you desire, want to achieve, and this is what defines success for you as a practice. These are things you want. These are your core values that patients don't see.
Right.
So
Why don't the patients see it? Why don't they?
Because sometimes it's putting profits before people.
Well, this is true. This is true. But I truly believe that if we always keep our patient's best interest at heart
Here we are
and
again.
in mind, then one follows
That's
the other. Yeah.
If you do it correctly, if you're doing the right thing.
But
from
we
the
have to
get-go.
have the entire office staff on board with it. And if somebody can't or won't buy into it, then we need to assess whether or not that person belongs in the practice. Because we want, again, from the moment they walk in to the moment they leave, we want to excite them, tickle them, exceed any expectations they may have had, and make them want to come back for more. You know, so that initial phone call when the new patient calls, you know, every staff member needs to know how to address a new patient call, not just the front desk or anybody working in the front end of a practice.
If you do it right, that patient's going to know the first name of who answers the phone. They're going to know the person.
Oh, absolutely.
There's going to be a relationship there.
Absolutely.
Every
But
time they call back.
The dental assistant should know, the person in the lab should
Yes,
know, the
they should all
hygienist should
know.
know. Everybody should know how to handle a new patient call, because you don't know
I
when it's
agree.
going to be you picking up the phone because somebody else was busy and you walked by and could grab it. Everybody needs to know how to handle the new patient call.
And the best practices they do.
Yes. You know, we need to make ourselves accommodating to the patients. So block scheduling is a big thing that people do now. There should never be a dental emergency that has to wait. We should have block time available for emergency patients. Always. And to that end, if that emergency time doesn't fill in for some reason there was no emergency, well, now we've got a little extra time in our schedule, so what do? We have a list of patients that we can call to fill in that schedule. But what do we do for that patient for calling them last minute? Well, maybe we offer them a percentage off the treatment that they're coming in for that day. So
Or we maintain a list of patients that are looking for the first available.
well, right, that's
Yeah.
exactly. But they might have a treatment
Right.
need, and so maybe they have a crown prep coming in. So we
We
offer
entice
them
that.
because they're going to fill in this last minute hole at the end of our day because they can be called last minute. We're going to give them a benefit for coming in and filling
They'll love
that
you for
hole.
that.
They'll refer their friends and family to you for that. And when they come in, what are we doing? We all know how to ask for a referral now because we've all trained up on it. We're all comfortable asking for referrals because, again, it's the referrals after retaining existing patients that are the easiest patients to get and the cheapest. It's getting the new patients out through external marketing that are the most expensive
That's the
patients.
This one practice I go into, and they have a card at the front, and they make sure every patient who leaves receives this card. But for every referral, that patient is given $15 of value towards treatment, and they keep a correct record of that
Right.
at all times.
Right.
So every referral is adding up to.
Which is a wonderful practice. We have to be careful because state by state, some of these laws, do change in what we're allowed to offer patients. One of the things that I was going to mention is, to make practices right, is having financial options available. We have the big two financial lenders that go into dental practices, but there's way more out there available. Some of them do auto billing for the practices. And so that's set up. We don't even have to think about it.
And there are special consultants and coaches that can help with that.
Absolutely.
selection.
One of the things I teach a lot of the practices that I've worked with, I set one of these up 15, 17 years ago, was a membership plan.
Right.
And in the state that I was working in, it was legal. And in most states it is. And, that's just a way to keep a patient, especially if we're trying to lose some of the insurance-driven, patient, practices, and so we want to maintain that patient. So we make it economically feasible for them to stay with us.
Yeah, and that does happen in Florida. It's allowed.
Yes, yes, which is one of the very few things allowed in Florida.
We've had that conversation.
Yes, we have.
We've had that conversation.
So those are
Those
a
are the
few
primary things.
Listen, it could be something silly, and we talked about marketing, internal, external, whatever we want to talk about, and making that patient experience perfect. But we used to keep apples and oranges and bananas washed and fresh up at the front desk for patients, because sometimes after a dental appointment they would be hungry, or their blood sugar would be dropping, or maybe they were rushing out the door to get there in the morning and they didn't have time to eat something before they came, and having all those little, we all have coffee and tea, bottled water. I know everybody's talked about that, but it's those little things. It's the fresh flowers. It's making sure that everything, whether you're a high-tech, high-touch office, or you're a very sedate, old world, heavy furniture type office, again, it's that experience that you're providing, and a certain type of patient will always gravitate towards a certain type of
You
office.
remind me of Paddy Lund, Dr. Paddy Lund from Australia. He wrote a book about the critical non-essentials of dental practice, and those specifically
Yeah.
those are talking about.
Absolutely. You have to, there should be no spot in your office untouched. Everything should be thought about. The days of the scenery wallpaper in Hawaii and flamingos, and those days are long gone.
No, it's
The
all
theme
modern.
rooms.
Yeah. So most of the interiors you go into new practices and build-outs are beautifully aesthetically conceived.
Right.
And there's congruent feel, look, and color, and it's fresh.
And it doesn't matter what it is. Like I said, I know I was in an office recently. I call it the IKEA office because everything was very modern like that. And there is not a detail that has been overlooked for patient comfort. It's very glass and clean lines and almost sterile looking.
But the patients love sterile.
They do love sterile, but everything, every little I was dotted, T was crossed.
Everything's in perfect order.
But I mean, they've got a very high. I mean, I think every cup of coffee they make for their patient probably costs $8.
Wow.
You know,
Wow.
high tech, high touch.
High tech, high touch.
So those
Well,
are a few things.
You don't have to go all that way.
No, you don't.
You don't have to invest that much.
No, you can get some
But
Folgers.
you can be exceptional and stand out.
Yes, you can.